Hello, my name is Dr. Catherine Birkin. I'm a pediatrician and researcher at Sick Kids, and I'm one of the co-leads of Target Kids with Dr. Jonathan McGuire. I want to thank all of you for your ongoing participation with Target Kids. We brought together our large team today to send you a huge message of thanks. These are incredibly challenging times with so much uncertainty for children, parents, and all of us. The Target Kids team are doing our best to adapt to these changes and to better understand the impact of these changes on all of our lives. We continue to build on our strengths and work towards our vision of healthy children together by partnering with community healthcare providers, families such as yourselves, and children to create knowledge to raise healthy children. We can continue to learn together and share this knowledge with you, our community, and the world at large.
Hi, I'm Marvick, the research assistant at Weathery's Children's Clinic. I miss seeing you all in person and looking forward to when we return to our practices. In the meantime, I continue to be busy working from home to connect with you. We are continuing with the regular Target Kids study data collection, and I'm sending out questionnaires and study packages on a regular basis. I'm also working with other research assistants to coordinate and distribute the new COVID questionnaires. I also work closely with our hardworking Target Kids research managers.
Hi everyone, I'm Dayla and I'm one of the project managers for Target Kids.
And I'm Christine, one of the research managers. I want to thank all of you for completing our weekly questionnaires. We're doing so well with those. We have heard your message to simplify the questionnaires, and we now have spaced them out, so you will start to receive the questionnaires less frequently. These ongoing questionnaires are important to measure you and your child's mental health, health behaviors, and wellness, and especially return to school. Thank you again for completing them.
Hi everyone, I am Chris. I'm a clinical research specialist on the Target Kids team. I work behind the scenes on the project operations and lead the data management of the study. All of the data that are being collected for the new COVID-19 study are being done through secure REDCap surveys. I work closely with the study biostatistician to ensure the accuracy of the data and to safeguard the privacy of the 675 families who are enrolled in the COVID-19 study.
Hello, I'm Charlie, a biostatistician and assistant professor of biostatistics at the University of Toronto. As the primary biostatistician working with Target Kids, my job is to help the other researchers in the Target Kids team get access to the data they need from the vast amounts of data that's collected, and to help them analyze that data in order to answer their research questions. As you can see, we've already collected over 5,000 surveys across the 675 families, but the more data we collect, the more interesting and important questions we'll be able to answer. So thank you for all of the information you have and continue to contribute to the Target Kids COVID-19 study.
Hi, I'm Zudi, a recent trainee, completed my master's at U of T, and I'm now working to answer some of the important COVID-19 related research questions that have emerged. For example, I'll be investigating how social distancing and isolation have impacted children's sleep, screen time, and physical activity during the pandemic. Our data showed that the majority of us complied with public health distancing policies, which was a heroic effort for all of us with our children.
Hey, I'm Lee. I'm a research fellow here at Target Kids, and my main work involves looking at how best we can support children and their families participate in healthy amounts of physical activity and screen viewing, as well as figuring out how best we can meet the needs of children, as well as related policies.
Hello, my name is Dr. Jonathan McGuire, and I co-lead Target Kids with Catherine Birkin. Since the start of the COVID-19 pandemic, we've worked with 675 families to understand how COVID-19 itself and its repercussions are affecting the lives of children and their families. Through the dedication of so many of you, we've collected thousands of nasal swabs to measure active COVID-19 infection in our community. And while laboratory analysis is still in progress for some samples, the good news is that we've had very few positive tests, and participants with positive tests have been notified. As COVID-19 cases have fallen in Ontario over the summer, we're taking a pause on nasal swab collection and refocusing our efforts on understanding which of our children and our families have been exposed to COVID-19 through blood tests. And with this information, we hope to provide research that helps us understand how to avoid COVID-19 and keep our children and households as healthy as possible. So on behalf of the Target Kids team, we thank you all for your incredible contribution during this difficult time, and we look forward to great things in the future as we understand how to grow our children to be as healthy as possible. Thank you. Thank you, everybody.
Thank you.
Thank you.
Thank you.
Thanks.
You.